people. So today, what I wanted to talk about was oral health and gut health, and the fact that they are closely linked. Oral health care is important to improving health. We often forget the health of the oral cavity affects gut health. For example, bacteria and inflammation in the mouth can impact the rest of the digestive system. If you are someone that's having heartburn, constipation, hormonal issues, any issues at all, you are probably not considering the impact that your oral health is having on your gut health, and that it might actually be affecting your overall health. So your gut is a reflection of your tongue. And so what I want to do today is talk about what to look for and what to consider when you are approaching your health. First, what can you do to assess the mouth without getting lab tests or without having to spend a lot of money? The first very simple thing is to look at your tongue. Stick your tongue out and ask your family member to do the same. And you are going to examine your tongue all the way to the back. And if you would like, post a picture and tell us what you think is going on with your tongue. The next thing I'm going to help you sort out is, what should you expect to see? Well, when you're looking at your tongue, a healthy tongue should be pink colored without a biofilm. So if you are seeing a film or a coating on the tongue, and it could be a very light film, when you're looking all the way back, that could actually be suggestive of a gut health issue. And that is pointing to what we would consider a problem with your oral health. And so what are ways to go about dealing with that? The first thing is, when you're looking at the tongue, like I said, you're looking at what the color of it is. Once you've gotten to that point, you then want to look at what might be wrong with how your tongue looks. So you're looking for a biofilm or any kind of coating. It could be a very thin coating. It could be a white coating. It could be different colors. It might not be a white color. It might even be brown. Some people might have a varying color and varying patterns depending on what is going on with their body. So once you have looked for whether or not you have coating, you then want to look for what we call fissures. And fissures are essentially cracks in the layer, the mucosal layer of the tongue. And they can be horizontal lines, they can be vertical lines, and really fissures can be any pattern. So it might be vertical, it might be horizontal, but keep in mind that any type of cracks in the skin or breaks in the and when I say skin would be the mucosal area of the tongue. Any of those changes is a sign that it's a sign of poor gut health, essentially. So when we see whether it's a fissure or a film or coating on the tongue, it is telling us that not only is there poor gut health, but specifically when we see fissures, we're thinking that there is an acidity problem. And it's likely a sign of low acidity. And there's also a likelihood that you are not absorbing nutrients the way that you should be absorbing them. So the position of the fissures can tell us where there's an issue. For example, if the front half of the tongue has fissures, then it's likely that it is pointing to an issue within the stomach. If there are deeper fissures, it's likely pointing to an issue within the small and the large intestines. And you also want to consider other features of the tongue when you're looking at it. If there is a scalloping pattern of the tongue when you're looking along the sides of the tongue, that might also point to poor gut health. Now, what do I mean by scalloping? Scalloping is when you have a wave-like appearance on the sides of your tongue, and your tongue might even be swollen. And if you see any of these changes, that's an indication of, again, poor gut health, and could be pointing to an issue with mineral deficiencies, which could be zinc, magnesium, or other minerals that you might be potentially deficient in. It is also important to consider what you're using when you brush your teeth. Now, we have all been, told to brush your teeth, twice a day, ideally right after meals. If you are someone who notices any of the changes that I've mentioned, and you're wondering, well, I'm following all the directions with brushing my teeth, and yet I'm here experiencing these changes. What are the things that you can do that might help? Well, when you're thinking about your gut health, oral health, and potential ways to improve that, there are other means or other options that you can try that might actually help with clearing up that imbalance that you have in your oral cavity. There is a product called an Ultra Binder, which I will place in the link, that can help with restoring oral balance. And that is essentially with restoring, what I specifically mean is restoring the microbiome balance of your oral cavity. And so this particular Ultra Binder works, it has what we call the ingredient of charcoal. And you would use it the same way that you do when you're brushing your teeth. You would apply it to your toothbrush and then brush your teeth like you do normally. And you will start to see that it's lifting all of that unhealthy stuff that really shouldn't be there. But the great thing about this is that this product helps to get rid of the bad, unhealthy microbiome, and it leaves the good, healthy bacteria behind. And so I'm just going to take a look at my phone here to see if there are any things in the chat. And I do want to again welcome everyone. If I'm not responding to the chat, it's because I don't want to get too distracted with replying, but I will reply to all your comments and all your questions. So picking up from where I left off, as I stated, the Ultra Binder is great because it keeps the good things where they need to be, and it gets rid of the bad things. The downside to toothpaste is that and I say specifically the toothpaste that we use, that we purchase over the counter, is that toothpaste generally gets rid of the good stuff and the bad stuff. It is not selective in what it does when we're brushing our teeth, which obviously can cause disruption and cause an imbalance within your oral microbiome. Another product that is good for oral health that might be worth trying is a product called Deltacidin. And it is an essential oil mouthwash. And you would use it very similarly to what you do when you're using your mouthwash. And typically, if you're, again, applying it and using it like a mouthwash, most of us don't rinse our mouth out right away after we apply mouthwash, right? It's the same concept with this type of mouthwash. You would, again, perform your typical oral rinse, procedure, your protocol that you do on a nightly basis or twice a day basis. And I would, even go as far as to say it might be better to not rinse it out, because then you're able to, again, keep your oral cavity, the microbiome that you want to exist there, in abundance. So those are two products that if you would like to learn more about, I will have at the end of the video, I will post that information for you. And those are examples of things that you can try to help to improve your oral health. Now, the takeaway point from all of this is that your oral health is vital to your overall health. It is interconnected with your gut health because that is where your food comes through. That is pretty much anything you put in your mouth goes through that. That's where it has to go to get to your gut. And so what you do with your oral health is vital to improving your health and optimizing your health. So that is all I have for you today. I hope that this was helpful. Please post your pictures, and we can, have conversations about what you can do to improve your oral health if that is an issue for you. Also, keep in mind, as always, that you can always DM me for any questions or any comments that you have. And I will also have a link there for you to set up a complimentary call with me if you'd like to, solutions to your health or just to learn more. All right. So that's all I have for today. I hope you all are having a great evening, and I will see you tomorrow for the next live video where I will talk about stomach health. All right. So hope all is well, and I'll see you guys in the next video.